Hi everybody, I'm Christine Sutherland. Welcome to Maternity Mondays, and I'm very lucky to have Bianca. Did I get it? Bianca. I've got it. I'm trainable. Keep on me, okay? Bianca and Andy as the team massaging today Katie. So we're going to do relay race kind of stuff. So it's going to be what you call 3-on-1. This is the one, us is the 3. And we're going to do variations on the theme. So for instance, if we had Katie in labor and we've got a husband and we've got, I'll be the sister, and we've got the niece and we're all there to help, then it's like, what do we do and when do we do it? That kind of thing. So she's just finished having a contraction, so now we're going to get on the job. So who would like to do the back? Great, you're on the back. So we'll drape the back, and then Andy, do you want to be on the hip? Yep, we're discreetly draped. Great, I'll let you try and drape that. I'll go on the arm. So right away, we all have a job to do. So what we're going to do is coconut oil it, and you might want to lose the watch anytime. And good work, what a team. Okay, and then we're going to all be massaging you, Katie, until the next contraction. And that's too much. I'll take some of that. This is the unhygienic way to do things, but it's a family plan, so here we go. Okay, so we're going to effleurage the back, and we're going to start like this, and we're going to go down and up, and then we're going to go into ringing, okay? And we're going to all effleurage, so I'm going to effleurage up, you're going to effleurage down, and Andy's going to effleurage around the town, and here we go. And then we're going to shift into the next stroke, which isn't so generalized. We're going to do very big strokes. Let's do palmar kneading for you and me, Andy. Reinforce one hand on the other. You can get right around the hip there. I think we got pretty discreet draping, but I'll make it even better for the camera here. So it's called a wedgie. So it means we're going to get all the gluteals exposed like that. We're going to have all of this draped nicely. There we go. I think we'll take even more around that way. Here we go, folks, just so that your home movies can be seen everywhere and anywhere. There you go. Okay, and then let's go into ringing. So you can go right up and across. Yep, you got it. You remembered. Wow, very nice. Everybody's ringing away. And you can go in close on any of those ringings, Bruce. And how do we feel from your end, Katie, being rung the right way in 3 different locations? Okay, and let's go into alternate thumb kneading. And, okay, oh my gosh, we got a contraction coming on. Okay, everybody hold it. Let me in on it here. Here we go. So we've got right here, we're going to put one hand on top of the other. I'm going to give you the preview. Here we go. We're going to hold that out of the way for me, Andy. And we're going to press. Here it comes. It's coming in strong. I'm pressing strong in this direction. I could also press in this direction. And we're just about peaking now. I'm pushing with my back leg as hard as I can. And we're coming down the other side. Nice deep breath. That's it. Good work. Good work. Yep, just breathe that right out. Yep, focus right on the center of that sensation. Good work, Katie. Yep, yep. And we're down the other side. And then we do the light reflex stroking. Okay, so we're going to go back to massaging until we get another contraction coming on. And then you can take a turn at that, Bianca. And then here we go. So where were we? We were at alternate thumb kneading. So we just pick up where we left off. And away we go. And when there's a part that's called transition, that means where, like say up to now, we've been getting contractions every 5 minutes. And now all of a sudden, they're every 3 minutes. And it's like, uh-oh, they're getting closer together. And we're just going to pretend 3 minutes is coming right up. And it feels like one's coming on, Bianca, so away you go. So one hand on top, yeah, take that stride position, yeah, and you got to talk to her. And a little further down, you want to get your heel of your hand right on the sacrum. So let's turn it around, turn it around, Turn around, there you go. Yeah, you had the angle right. There you are. That back leg straight out. Yeah, perfect. Okay, and then talk her through.
Hi.
That's close. Try deep breath in.
Deep breath in.
And use her name. Even if you say Auntie Nikki, doesn't matter, whatever you call her. Keep talking to her.
Take a deep breath in, Katie. Let it out through your mouth. Take another deep breath in.
And coach her.
Take a deep
Doing
breath
a good
out.
job. Tell her she's doing a good job.
You're doing a good job.
That's it. And then you say, focus right on the center of the sensation.
Focus right on the center of the sensation.
Good work. Okay, now it's peaking, so you're pushing with all you've got. Lock those elbows and really lean into her. Yep, that's good. And this is where you guys say you're doing good.
You're doing a good job.
Yep.
It's almost over.
Good, that's good. Coming down the other side now, you still keep your pressure. Keep it on, keep it on. And we're just about gone. And then you say,
Good job. Done.
and then the light reflex stroking. And why do you do the light reflex stroking, do you think, Bianca, at the end? Any good ideas coming up?
No.
Okay, so if I press like this on you, really firm, you can kind of feel where my thumb was, right? Then if I do a light stroke like this, does it erase where my thumb was? And that's what we're doing. We just got to apply the eraser every time, because in another few minutes we're going to do that again. Okay, let's switch. You're on the arm, Andy's on the back, and I'm on the leg. Here we go. So we just pick up, I was around there, somewhere around the elbow. So folks, that's the kind of thing to be able to do when there's a whole group of you. You know, 2 of you or 3 of you. You can always change jobs during what could be 2 hours of labor or 22 hours of labor. So it's really great if you can move around. It's also great if you can work on each other, you know, so that we've been doing this for, you know, like an hour now, and she's got these contractions that are very positive, they're very strong. And then what you can do is go down this way. So you put a hand on either side this way. Yeah. And then you just can wrap right around. There you go. And you can also straighten her out. She could be like that, and you could hold it up and back right up there. And you're still doing that alternate thumb kneading. You can have 2 hands on the job, and you can hold it up yourself like that. There you go. Yep. But don't lean over. Lift her up instead. Yeah. Because especially this is like a marathon massage. Like, there's no stopping. She's not going to stop the labor. So you really want to make sure that you're able to keep your stamina and preserve your back. That's good. And just focus thumbs, like that. Push up and out. Very good. Yep. Yeah, that's a bit of a flying thumb. Don't let it off. Nice work. And especially, up here she goes. She's got another one, so you hold on there. Andy's on it. Okay, Andy, go for it. And we stay still.
Keep on breathing. Deep breath in. Really deep. And let it out. You're doing great, Katie. Keep on breathing. Let a deep one in. You're doing awesome. Keep up the breathing.
We're at the top. Now we're coming down the other side.
You're almost there. Perfect.
Good work. And then that was great, Katie. Did a great job. So you get the idea that we're going to be interrupted as we go, but when we just get right back on, it's great. So this is where it's really good to build up your stamina, like for 20 hours of continuous massaging. I think there should be massage marathons for families to build up their tolerance. Then you know everyone's ready for you when you go into labor, right? We're up to 16 hours. Yeah. I'll be the willing subject. Okay, so that's great for sideline. And then let's do another version of labor. and have you face up.